As we begin to think about how we want to communicate results to patients and referring clinicians in the future, first and foremost, we need to keep the end user in mind. So many of our technological advancements in the last 5 to 10 years have certainly benefited the radiologist. Things like voice recognition software, macros, standardized reports, and pre-populated reports certainly increase the efficiency with which we can produce a final report. But the referring clinician and the patients are still receiving the same text-based report that they've received since the beginning of time, whether that's on the screen or on paper. So we definitely want to take their opinions into consideration. Maybe patients and referring clinicians want embedded hyperlinks in their reports. Maybe they want flash-based software to view their reports, and they can look at images and scroll through images from cross-sectional imaging. Maybe they don't, though. Maybe referring clinicians would like to be able to store images in a teaching file. Perhaps video consults with patients or referring clinicians, live time at the PACS reading station is a possibility. That may be a technology they would like to utilize. It may not be. So we must keep the end user in mind as we continue to make advancements. Additionally, we need to consider that web-based platforms are becoming obsolete quickly. Tablets and smartphones have changed the way we communicate with each other, and anything that we build or any new thing we do probably should be on an application-based format. I don't think it's any secret that within the next 5 to 10 years, all clinicians within a hospital and within an outpatient setting are going to be functioning on a tablet rather than a laptop or standalone workstations. And then finally, the last thing to consider when we talk about communicating results to patients and referring clinicians is how can we change the workflow within a department so that it's possible to communicate results directly to patients. This is a controversial topic with many obstacles that need to be overcome, but I don't think it's far-fetched. I don't think it's too far-fetched to think that patients are going to be wanting to get the results from a radiologist at the time their study is obtained. And that's going to take significant IT advancements in how the workflow in our department functions. The current RVU-driven workflow certainly is not accommodating to what we would need to do to communicate results effectively to patients. So it's something else to keep in mind as we move forward.